Well, hello. Okay, so you that sort of went by fast, but I want to introduce our guest tonight, Dan Sheeran, who serves as Vice President and General Manager for Amazon Web Services Healthcare and Life Sciences Business Unit. So today was a busy day for Dan, both in the meetings that he had today and also as an organization. But we are really delighted in the theme of tonight's events to think about collaboration and partnership and headwinds and opportunities. And AWS is a huge partner for the city and for us at Pitt and for many of the people in this room. And as we think about the theme of healthcare and technology and AI intersecting, I can't think of a more expert person to think about what we launch off of platforms to do and some of the opportunities that we have. So please join me in welcoming Dan to the stage.
Thank you, Joan.
So this is a partnership spotlight. That's what we are doing right now, and we're very proud of our partnership with you. AWS is sort of in an interesting position on this because you're both a convener and a provider, and you work with everybody. You work with life sciences organizations, big pharma, tech, startups, huge organizations, of course, universities. So let's start locally, since you spent the day in town and met with a lot of different people. What is your view on the importance of local and regional hubs for creating the right kind of innovation and AI and tech ecosystem that we all hope to achieve?
Well, I am going to answer your question, Joan, but first I want to thank you and everyone who's made today possible and invited us to participate. We really viewed it. I viewed it as an honor before hearing the awards that were just provided, and I will say nobody told me I had to quote Aristotle or Plato, or Socrates. But I'll try to remember that before we finish and drop something in. Now I'm going to answer your question. Yeah, it was a challenging day. Thank you for bringing that up. Look, before I describe how we see partnerships, private partnerships with public-private partnerships work, perhaps I should spend a minute on why we spend a lot of time on it. And we really do at AWS and broadly at Amazon. And that is because so many of our customers, and we ourselves, and I mean this at a personal level, are focused on challenges that no one organization or institution is capable of addressing on their own. And whether you're thinking about climate change or you're thinking about cancer, these are very hard problems that even organizations of our own size are not remotely capable of tackling. And that's why, frankly, being here is so meaningful to me, because it's collaborative organizations like the Council on Competitiveness that is exactly what we need. And so we're just very grateful to be part of it. One thing we have found, and we do invest in a lot of partnerships here in the state of Pennsylvania. We announced a $20 billion investment earlier this year, which I think may be the largest single private investment in the state by a single entity like ourselves. And that was not just to build out infrastructure. It's also because of our deep commitment to enabling researchers throughout the state. Pennsylvania really over-indexes in terms of the breadth and depth of life sciences researchers, material science, health sciences. And so what is the filter? What is the decision-making process when we look at it, and what do we think is key to a successful partnership? Well, the first is focus. We used to do a number of relationships where we would decide that we had a shared set of values and goals, but we weren't specific enough. And so we've increasingly focused our partnering around very concrete ideas. We have a collaboration with Pitt for a Cloud Innovation Center that's very specifically focused just in two areas. One is around sports science, and one is around health science, with from the get-go having measurable, specific use cases that we've agreed on up front, where we can measure progress. The second thing that we look for is opportunities where this may sound obvious, but if you're not intentional about it, sometimes you don't actually achieve that. And that is where the whole truly is greater than the sum of the parts. And a good example of this is together with about 3 dozen of the children's hospitals around the country, including here in Pittsburgh, we have been very actively involved in something called the Children's Brain Tumor Network. For the past several years, through capital, through resources, through cloud computing. Why are we so focused on that in particular? Because children's cancer, pediatric cancer, as many of you probably know, some much better than me, is one of these challenges where so many of the cancers are so rare that in any one given metropolitan area, you don't have enough patients to do enough of the science for either a diagnosis or therapy development. And so being able to use cloud technologies where we can connect many different institutions, not just around the country, but really around the world, to collaborate and share, de-identified data with patient permission is exactly the kind of thing that we think is key to partnerships, and we think it's the kind of model that we need to be doing more of, particularly at a time when we all know it's increasingly challenging to source funding from certain sources that we all counted on before.
So we couldn't agree more in the importance of that kind of collaboration in order to find solutions. And I think one of the things that having the kind of industry partnerships that Farnham referred to and having you all specifically allows us to do is to create the platforms from the technology that allow us to do things that otherwise we wouldn't be able to scale. And of course, that kind of collaboration is why we're all here. So co-sign on that sentiment. But if we were to widen the aperture a little bit and think about what you're describing and translate it into trends, given the focus of your work and the tools at your disposal, what sort of trends would you identify around the kinds of things you're working on?
Well, certainly, I spend a lot of my time working with the largest life sciences companies. Just for context, 9 of the top 10 pharma companies principally use AWS as their technology partner, which I raise not to brag. I raise because it's relevant for this question. And because that, as a result of that, we deeply understand their priorities. When the CEO of a pharma company sits down with our CEO, without fail, one of the top 2 answers they will give, if asked the question, how can we help you, is help us speed up clinical trials. And this is where, so that's been a long-standing trend, but what's new about the trend is, number one, the potential that AI has to speed up clinical trials and make them more successful through technologies like digital twins and essentially designing the protocol in a much more sophisticated way to be more likely to succeed. The challenge is accomplishing that requires access to data that the pharmaceutical companies don't have. And that data is sitting in health systems. And therefore, there is a absolutely tremendous opportunity for collaboration far beyond what happens today for appropriate sharing of de-identified patient data to advanced life sciences research. A lot of it already happens, but it happens too slowly. It is typically from the time a researcher at a pharmaceutical company decides they want to answer a certain question, they therefore need to build a cohort of patients who look like X with the following criteria, it will take them about 8 months before they have the data to answer that question. And through the use of a lot of technologies we've been developing and other companies have been developing, and through new business models, partnership models, we think we can really radically transform that. And it's not just I don't just raise it as a great business opportunity, I raise it as a wonderful way we can get therapies to patients a lot faster.
Can you give us some examples of some of the, how much can you share about some of the ways you're acting on these opportunities?
Sure. So, and this is not just in the US, this is internationally as well. There's been an enormous amount of investment in the US and in certain other countries, particularly the UK, to create these biobanks of data where citizens voluntarily will have their genome sequenced and have their access to their clinical record made available for researchers. We've actually seen far less results from that than everybody was hoping. There have been some extremely important insights, but not at the grand scale that we all thought. And we've realized, working with our partners, both in the US and many other countries, that the technology design and obstacles around understandable policies around access to data, which have been extremely focused on ensuring patient privacy and data not leaving a given country, all legitimate goals, have made the researchers' experience so challenging that a number of researchers, both in academia and in for-profit life sciences organizations, have just given up. And so we've been investing in technology, not just ourselves, but others. I won't get into the details of it, but essentially it's called clean room technology, where you can, instead of bringing the data to the query, bringing the data somewhere else to do the machine learning, the data stays where it is, and you bring the query to the data. And so we're very excited about that. We're rolling that out with a half a dozen pharmaceutical companies as we speak, and then also with a number of the data originators, meaning the custodians, like some of the organizations in this room.
Can we talk for a second about the industry-university partnership side of things? What makes universities, besides the obvious example of the researchers themselves, interesting partners for you?
Well, first of all, it's where a lot of the smartest people in the world are, and that matters when you're trying to solve very hard problems. I think another one is the universities oftentimes have not just the super smart people. They have, particularly universities that have a health system, can have, with the right approach, and we've seen lots of examples of this in Pittsburgh at UPMC and at Pitt, have relationships where you can go from idea to experiment much faster. I know it may not seem fast, but it's faster than it has to happen when you're dealing with completely separate organizations. Another reason why we think that universities are really ideal places to experiment is because there are oftentimes funders who are seeking for a way to, philanthropic funders, for example, who are seeking a way to make a contribution, but only investing in a for-profit entity is not consistent with their mission. And so the BioForge example, here, we think is a wonderful example of a model that involves, a for-profit entity in Elevate Bio, philanthropic involvement, university involvement. We think it's really a wonderful model that, is going to result in personalized therapies getting developed faster and getting manufactured faster. For those of you who don't know, we would be many more people would be benefiting from personalized therapies if it didn't cost on average more than $1 million per patient to actually manufacture it. And so we need to make it very significant advances in cell and gene therapy, not just development but manufacturing. And so these types of partnerships are really critical.
Well, and we love the BioForge example, as you might imagine, but and we had a long talk about it today. So let's, I've asked this question of a couple of your colleagues and counterparts over the course of our meeting so far. If we were to look ahead 5 years, which seems like an eternity given the pace with which AI as an option has even been introduced into our imaginations, how would we know that we got it right?
I think we would see clinical benefit. And, for all of the hype that we're seeing thus far, the initial implementation of AI will be, the initial benefit will be lowering costs. And we're seeing that enormously. We're seeing, especially in radiology, we have customers who are getting 30+% more scans read, per shift than was true even 2 years ago using this latest generation AI. But that's largely the same medicine being practiced either cheaper or faster. And so I think the answer to your question, Joan, is when we see it practiced better, where we have diagnoses that otherwise would not have been made, or cures that otherwise would not have been administered. And that's coming, but those are harder problems, and so they'll take more time.
I couldn't agree more. So with that, let's thank Dan for joining us tonight. Thank you, Dan. I really appreciate it. And thank you for the partnership.